All right, welcome everybody. Happy Tuesday morning. I'm Rachel Flum. I'm the Strategy Director and Policy Analyst for the Economic Progress Institute, and we're happy to see you all this morning on our webinar, Building a Better Rhode Island. We're pleased to have had over 100 folks register for this panel today, and it is such an important topic to talk about today with Naomi Walker, our keynote speaker. To try to think about how Rhode Island can really recover from this COVID pandemic in a way that ensures that all Rhode Islanders are able to thrive. We invite you to introduce yourselves in the chat and so that we can see who's here with us. But we're excited to see that our colleagues across state government, legislative champions, donors, funders, and new and old friends registered today, including our new interim executive director, Margot Morrissey. Oh goodness, my mouth is not working today. Margot Morrissey, who is starting today. So welcome and happy first day, Margot. We wish we could all be here together in person like we usually are in the spring for our annual budget and policy conference. But we didn't want to let the spring get away without a conversation on how we can pass good policies to improve the lives of Rhode Islanders. So we're really excited to have Naomi provide us with some inspiration and motivation to keep fighting the good fight this legislative session. And this is a great moment to do that. Naomi, our budget hearings are coming up fast and furious after the legislators just came off their spring break. So we would like this to be a conversation with all of you. The agenda for today is that Naomi will provide some remarks for about 20 minutes. Then I will come back on and provide some local Rhode Island context and updates on a lot of the work that we're all doing together. And then Naomi and I will be available for questions. We encourage you to chat with each other in the chat and ask your questions in the Q&A so we can keep track of them and that they don't get lost. And we should have lots of times for question and answer in the end. We are recording this, so if you have colleagues who would like to watch it later, we hope that you will share it with all of them. And if we don't get to all of the questions, we can follow up with those after that as well. So without further ado, let me introduce Naomi Walker. Naomi has been with the Economic Analysis and Research Network, or EARN. She's been the director there for about 3 years now. EARN is a national network of organizations advancing an inclusive, worker-centered economy through state and local policy change and rigorous research. We here at Rhode Island EPI are proud to be one of the nearly 60 member organizations which are spread across 43 states and the District of Columbia. EARN is coordinated by its member organizations and staff at the Economic Policy Institute in Washington, D.C. And before joining EARN, Naomi was the former state director of the AFL-CIO and also worked with AFSCME before that. And I know we have representatives from our labor colleagues around the state who are here with us today, and we'll give Naomi a warm welcome. So thank you for joining us, Naomi, and I will turn it over to you.
Great, thanks so much, Rachel. And hello, everybody. It's nice to see my labor brothers and sisters on, Jim Parisi from AFT, who I worked with many years ago. I'm so looking forward to our conversation today, but first I want to start by, saying, Rachel, thank you for all that you've done for Rhode Island families in your role as the former ED of Economic Progress Institute. And I'm really looking forward to working with you in your new role, as well as working with the new interim executive director, Margot Morrissey. So I want to start off by spending a couple of minutes talking about the impact of the pandemic and the recession on workers, particularly the low-wage workers, women, and Black and brown workers who've been hardest hit. There are three main groups of workers in this COVID-19 economy: the folks who've lost their jobs and face economic insecurity, workers that are classified as essential workers and face health insecurity as a result, and then those who've been able to continue working from the safety of their homes. And compared with other recent recessions, this pandemic-induced recession has been particularly hard on low-wage workers, with record numbers of job losses over the course of the pandemic. Between 2019 and 2020, the economy lost nearly 7.9 million low-wage jobs in industries like restaurants, hospitality, retail, and other service sector industries. And yet, over the same period, the economy actually gained nearly 1 million high-wage jobs. And so this two-track or K-shaped recovery, as you might have heard it talked about, has only magnified existing racial and gender inequities. Latinx workers are overrepresented in some of the hardest hit industries, and the devastating job losses we saw last year were particularly hard on Latinas. In the spring of last year, Hispanic unemployment was close to 20% at one point, and many of those workers and households were completely excluded from most of the support programs put in place through the federal relief and stimulus bills. Black workers have also suffered disproportionately from the pandemic's economic fallout. As of March of this year, the Black unemployment rate was 9.6%, compared with 4.9% among white workers. And Black workers are not just twice as likely to be unemployed as similarly educated white workers, but are often more likely to be unemployed than less educated white workers. And while Black and brown women's employment numbers have been rebounding, Black and brown women still have much higher unemployment rates than white women. You know, a lot of Black workers continue to work through the pandemic, but because they were disproportionately in the essential and frontline jobs that kept the economy going, you know, they had to continue to go to their workplaces. They were facing health risks, risking the health of their families, often able to sustain the adequate social distance from coworkers and customers, and often didn't get any additional financial compensation for the added risk that they were taking on. You know, throughout the pandemic, we've heard this talk about, you know, everybody's working from home, and certainly for a lot of us white collar workers, that is true. But when you look at workers as a whole, only 30% of workers can work from home. And unfortunately, Black and brown workers are the least likely to be able to do so. And to make matters worse, as you all know, those who've had children have had to navigate continuing to work while also providing care for their children as schools were closed because of the virus. And then lastly, I just want to say, in terms of framing up the economy, that even though the economy is starting to show signs of strengthening, we're still down 8.4 million jobs from February of last year, and nearly 11 million jobs if you factor in all the jobs we would have added since then just to keep up with the population growth. So there's still so much work to do. So what's it going to take to make these workers and our communities whole? What will it take to create a just and equitable recovery? The American Rescue Plan really provides an immediate lifeline for cities and counties and state budgets. And it's critical that we use this unprecedented infusion of funds smartly and strategically to help support worker-centered policies that rebalance the economy towards one that works for everybody in Rhode Island, particularly those hardest hit by the crises. And if we focus our policy making in the ways we always have, that is by focusing on universal policies and hoping that they just trickle down to the people that need them the most, we're really gonna miss the boat. Instead, we should focus on ensuring that we're taking care of those low-wage workers, women, and Black and brown workers, knowing that if our policies support those workers, the benefits actually will trickle up to the broader population. There are a lot of worker justice reforms that are needed to create equitable recovery. And I know Rachel is going to cover some additional ones as soon as I'm done. During our time together, I'm going to try to make my way quickly through 5. The first is increasing the minimum wage and tipped minimum wage, raising taxes on the top 1% to try to build a more racially equitable tax system, passing fair work week reforms, taking care of the undocumented workers who, as I mentioned before, were left out of some of the federal recovery bills, and improving Rhode Island's paid family leave and paid sick time so they better support workers and families. So let's just dig right in. A minimum wage, it's been stuck at $7.25 since 2009, and it's actually lost 35% of its value since the 1960s. And we're in a period that has been the longest in history since Congress has raised the minimum wage. And we're sort of beyond the time when we need to act to raise it, because the longer we wait, the more workers fall behind, and the harder it is to get the minimum wage to a level that will actually allow people to afford a decent quality life. Rachel just mentioned when we were talking earlier today that it was just announced that President Biden is going to be raising the minimum wage for federal workers to $15 an hour, which is great. And at the same time, it's unlikely that the Senate is going to pass the Raise the Wage Act, which would raise the minimum to $15 an hour for workers all over the country. And so it really is up to the states to act instead. And I know that Rhode Island has taken really important steps toward this goal, raising the statewide minimum wage to $11.50 an hour in October. But there, again, is a lot more to be done. I think the legislature should raise the statewide minimum wage to $15 an hour for workers throughout the state, including workers who rely on tips to make ends meet. And we'll talk more about them in just a second. Raising the minimum wage in the Ocean State to $15 an hour would help about 131,000 low-wage workers and would have really positive equity impacts and weaken some of the systemic income gaps based on race and sex and ethnicity. 43% of Latinx, 34% of Black, 29% of Asian, and 21% of white workers would benefit. And almost 1 in 3 women and 1 in 5 men would benefit too. And the thing about raising the minimum wage is it's not a politically risky move. It's actually extremely popular with voters. For at least the last 15 years, every single time a state has put minimum wage, raising the minimum wage on a ballot, and it's been put to a vote of the people, it is passed by an overwhelming margin. Just this past election, voters in Florida, one of the most sharply politically divided states in the country, voted to raise the minimum wage to $15 an hour. And poll after poll shows that voters are more likely to support candidates who stand up for raising the minimum wage. And so regular folks get that it's hard to make ends meet as a minimum wage worker, and policymakers really should too. So let's dig in a little bit more to what minimum wage workers here in Rhode Island make. A minimum wage worker who works full-time earns just under $24,000 a year. And my colleagues at the Economic Policy Institute in DC, I know I'm going to get our organization names confused at some point during this, but the colleagues at our EPI developed a family budget calculator, which allows you to plug in any county in the country and see what it would take a worker, a family of various sizes, to live a modest but adequate lifestyle. And Rachel, I know that the Economic Progress Institute has a similar calculator, the Rhode Island Standard of Need. And our methodologies are slightly different, but the conclusions are very similar. So let's take a look at the family budget calculator. And this is for a single worker with no kids who lives in Providence. And it goes through what they would need to earn each year in order to take care of their basic needs. And you can see housing, transportation, healthcare, food, taxes, other essentials. And you can see there's not any padding in the budget. Other necessities are budgeted at $405 for the entire year, or about $34 a month. And that doesn't include money for entertainment. That's cleaning supplies and telephone service and school supplies for their kids and furniture and all those things, $34 a month. Their annual income would need to be close to $34,000 to live modestly. And that's about $10,000 more than the statewide minimum wage provides. If you go to the next slide, you can see that there is no county in Rhode Island where a worker who's working full-time, earning the minimum wage, can actually support the cost of living in that area. And so the blue bar is one adult with no children. The orange bar shows you what happens if you add just one kid into the mix. And that you can see that the amount needed to sustain that family skyrockets to between 55,000 and 68,000, depending upon where in the state they live. And so I think it's pretty clear that Rhode Island minimum wage workers need a raise. I want to talk a second about tipped workers, but first I want to start with a super quick 2-question quiz. And who doesn't love a quiz first thing on Tuesday morning before you're properly caffeinated? But let's dig in. You all probably know these answers, but if you can just drop them in the chat. So the first question is, what's the Rhode Island minimum wage for tipped workers? So this is, bartenders, waitresses, taxi cab drivers, those sorts of folks. What do you think of the minimum wages for tipped workers? Just put your answers in the chat. Okay, getting some answers here. Okay, good. Looks like most folks are putting in D or E, some C's. Okay, we'll come back to that in a second. And then what percentage of tipped workers are women? We have very smart people here, obviously. Okay, so let's dig into those two a little bit. Under federal law, workers who typically receive just $30 a month in tips can be paid a base wage by their employer of as little as $2.13 an hour. So a lot of people said $2.13, which is true at the federal level. That amount hasn't been raised in 30 years, since 1991. But here in Rhode Island, advocates convinced policymakers a while back to raise the base wage for tipped workers to $3.89 an hour. But as we saw from our last discussion, if $11.50 an hour doesn't cut it, we know $3.89 won't cut it either. Tipping itself has a deeply racist history that folks are just beginning to talk about. As Saru Jayaraman, who's the head of the Restaurant Opportunity Center, which is a group that organizes restaurant workers, describes, after emancipation, the restaurant lobby demanded the right to hire newly freed people, mostly Black women, not pay them anything, and have them live entirely on this new idea that had just come from Europe called a tip. And in 1916, there was a writer named William Scott who said, tipping and the aristocratic idea it exemplifies is what we left Europe to escape. It is a cancer in the breast of democracy. But the railway and restaurant industries fought for using tipping as their employees' entire wages to exploit their African-American labor force, and they won. And this legacy of slavery was really baked into the New Deal era Fair Labor and Standards Act in 1938, which set the country's first federal minimum wage at 25 cents an hour, but it completely excluded hotel, restaurant, and other service workers. And then about 20 or so years later, in 1966, there were some significant amendments made that included those workers, but at the same time introduced a sub-minimum wage for tipped workers. And that law, which is still the law of the land, says that if workers' tips plus their base wages over the course of a week don't add up to the minimum wage, employers are supposed to top them off so that they come up to the minimum wage. But that requirement is so extremely difficult to enforce, and it leaves tipped workers enormously vulnerable to wage theft and harassment and discrimination and these huge swings in their weekly income, since the majority of their pay is completely dependent on their customer base and the whims of those customers. I think there's this mythology in this country about tip workers, that they're secretly making more than any of us, pulling in 6 figures, and that is just not true. Tipped work is overwhelmingly low wage work. And yes, there are some staff at higher end restaurants that do well, but that is really the exception and not the norm. And the median wage for wait staff and bartenders in states that use the 213 tips minimum wage is about $11 an hour, including tips. Okay, answer to question 2 is D. There are over 4 million tipped workers in the US, and 70% of them are women. The majority of them work in food service. There's other occupations that sometimes use the tip minimum wage: nail salons, hairstylists, gaming service workers, sky caps, those sorts of things. And one of the really sad things about tipping is that research shows that men tend to be better tipped than women. White tipped workers are tipped more than Black workers, even for the same reported quality of service. And I think that's an important point to emphasize. This is for the same reported quality of service. And so restaurant workers and other tipped workers and worker advocates are advocating all over the country for states to pass what they're calling one fair wage. And that is to create one minimum wage for all workers, including restaurant workers, and to get rid of the extremely low base wage that allows both employers and customers to exploit these workers. 8 states have passed one fair wage laws, and hopefully Rhode Island will be among them soon. The last couple of policies that I want to talk about, I want to first dig in on raising taxes on the top 1% so we can reduce racial inequity and spur investment in key public programs. And so state and local tax policies, as well as other public policies, have for a long time maintained and in some cases actually worsened existing wealth and income gaps between white workers and Black and brown workers. But the legislature really has a chance to fix that by requiring the people least impacted by the pandemic and recession to step up and pay their fair share in taxes. And I was excited to see this proposed legislation to tax the top 1%, which in Rhode Island is households with adjusted gross incomes above $475,000. And that would really help reduce racial inequality and allow the state to raise more than $128 million to invest in public programs that that those most impacted by the crises need. You know, white Rhode Islanders account for 89% of the top 20%, even though they make up only 75% of the overall population. And when you look at Black and Latinx Rhode Islanders, very few are among the top 20% of income earners, whereas 26% of Black and 32% of Latinx Rhode Islanders fall in the lowest 20%. So again, these proposals to increase taxes on those with the largest incomes will really decrease the racial and ethnic income gap in Rhode Island in 2 ways. One, it'll change how much just a few people at the top are paying in taxes, but it'll also provide revenue to invest in a more equitable society. And I think it's a really exciting proposal that the Economic Progress Institute and its partners are working on. And then I want to dig in into some of these policies impacting how families juggle work and their families. And it just shouldn't have taken a global pandemic to drive home for many people just how truly terrible our country's policies are on work and family issues, but it did. And we need to help workers balance work and family by guaranteeing paid sick days, paid family leave, and fair scheduling. And of course, the federal government should pass a permanent law that provides robust paid family leave and paid sick time. But again, in the absence of federal action, it's really up to the states to fill in the gaps here. And of course, Rhode Island has taken a significant step by enacting the temporary caregivers insurance, which, as you all know, provides partial wage replacement for up to 4 weeks for workers who need to take care of a sick spouse or other family member, or to allow them to bond with a new child after adoption or birth. But more needs to be done to make sure that that program really meets the needs of the parents and caregivers who need it the most. And in a lot of cases, 4 weeks just isn't enough to provide the kind of care that family needs. And particularly for low wage workers, the wage replacement rate is just not enough to allow low wage workers to actually make use of the program. And so that needs to change, and both the number of weeks and the wage replacement rate need to be significantly increased to make the program useful to parents and other caregivers. I want to talk about a law that I don't think is being discussed in this legislative session, but I'm hoping that advocates will take it up, and that's these fair work week laws. You know, one of the things that we see with low wage workers is that having really unpredictable and unstable hours at work, you know, have really become a big problem for low wage workers in retail and other low wage industries. And these volatile hours not only lead to volatile incomes, but also add to the strain that working families face. And the problem has been exacerbated by this new scheduling technology that enables employers, again, really in retail and fast foods, adopt this just-in-time scheduling. And so these new algorithms allow employers to hand out schedules based on the time of day when there's going to be the most customers. A lot of times they split up workers' hours across a bunch of different employees, and then sometimes they send people home if customer traffic is slow. And so that means that work is completely unpredictable for low wage workers who don't know how much they're going to earn from week to week, or if they're even able to make plans. And how do you plan ahead for childcare, or juggle schedules to take classes, or hold down a second job, or pursue finding another job when you have no idea what days or hours you're going to be working? And Black and Latinx women face the most abusive schedules, according to a recent study that was done of 30,000 workers in the retail industry. And I want to share a short quote from a worker who's organizing and advocating for change with United for Respect, which is an organization of retail workers across the country. And she's not a Rhode Island worker, but she could be, because this is happening everywhere. And her name's Jenny Allen. And she said, on Saturday, I would know the schedule for Sunday. So that's one day, not even 24 hours in advance. So how can I even make plans with my kids? It's the weekend, they're not in school, so I want to do stuff with them, but I can't tell them, hey, let's go to the beach, or let's spend time, or go to the park, or anything. If my schedule was out 2 weeks in advance, I could make the doctor's appointments that they need to go to. I could make time for family time, or to take them to the park. They're young. I'm all they got. It's just me. And to help workers like Jenny, states and cities are starting to adopt fair workweek laws that provide workers with greater stability and predictability and flexibility in their work schedules. And in a lot of cases, some of these new laws also require employers to offer their part-time staff opportunities to increase their hours before adding new staff. And I am hoping that Rhode Island will follow their lead and push for fair work week legislation to protect workers in the Ocean State. And then lastly, and I feel like I've been talking for 4 hours, so I'm sorry, I want to turn it over to Rachel. The last policy I want to highlight would really help undocumented workers and other workers who were left out of the Federal CARES Act and unemployment insurance and almost all other forms of federal assistance. And so several states have been going down this path to explore what can be done to support these workers. And I'm just going to quickly mention 3 of them. New York just enacted a law creating a $2.1 billion fund with 2 tiers of aid for undocumented immigrants and other workers with non-traditional jobs. And tier 1 is roughly equal to what other workers got through unemployment insurance, and provides $15,600 to undocumented workers who can meet really very strict standards and proof of eligibility. And then there's a second tier, which pays $3,200, which is the equivalent of the 3 rounds of the federal stimulus payments. And In addition to helping the workers, an influx of money of this size is really going to have a stimulative impact on New York's economy. Vermont's legislature sent a bill to the governor that would include $5 million in the state budget to provide support for Vermonters who are excluded from CARES Act funding, including migrant workers and their families. And eligible adults are going to get a one-time payment of $1,200, and kids under 17 would get $500. And then lastly, Maryland enacted a $1.2 billion stimulus package that includes sending up to $500 to low-income families and I-10 filers who were financially hurt during the pandemic. And Republican Governor Larry Hogan opposed the bill, but decided not to issue a veto, so it became law without a signature. So the federal stimulus money that's coming into the states provides some fiscal space for states to consider these kinds of approaches. And I hope that Rhode Island really explores what can be done to make sure that no workers are left out. So I just want to close by saying that Rhode Island has this incredible opportunity right now and responsibility to make whole the lives of the workers whose employment and income and health and families were completely upended by the pandemic and the recession. And I'm looking forward to hearing from Rachel and to our discussion.
Great. Well, thank you, Naomi. That was really educational for me, and I know for so many folks on the call. Oh goodness, I hit the wrong thing. I know people are hoping to get some of that data shared with them later, which we certainly can do. And here is Naomi's contact information from EARN in case you want to follow up. I'm sure most of the data that you provided is actually on your website somewhere. You're a huge resource for all of us. And so we thank you for that and for your remarks today. So I know we have a number of questions, but I wanted to just provide some context for what is happening here in Rhode Island on a number of the things that you talked about. You know, unfortunately, we don't have big campaigns right now around the fair scheduling or around benefits for undocumented workers. Maybe that will change after today. But we are working on a number of things to try to make sure that we come out of this recession in a way that doesn't just get us back to where we were before, but is really intentional about ensuring that we have an ongoing equitable situation for all of Rhode Island's workers. So I'm going to start with, so just briefly, our policy agenda is on our website, so you can go there for more information. And I'm just going to walk through some of the things that are in our policy agenda and then some of the other work that we know is being done. There's a lot going on even this week on a lot of these issues. So first, just on the tip minimum wage, you know, there is a lot of momentum around increasing the minimum wage here in Rhode Island, which is the good news. Where we are right now is that the Senate has passed Senator Casada's version, Senate Bill number 1, which would get the state to $15 an hour by January of 2025. The House version of that, Representative Bennett's, is actually expected to be voted out of committee tomorrow. So it looks like there is real momentum around that moving forward. Unfortunately, that version of the bill does not include the tipped workers, which you talked about how important those workers are and how important it is to pay attention to that piece of this issue. You know, we at EPI have been supporting Representative Ranglin Vassal's bill and Senator Chacon's bill, which have both a path to 15 and increase the tip wage up to half of the minimum wage. There are a number of other bills that have been introduced that would look at increasing the tipped and getting it all the way up to 15. So I thought it was helpful to hear your remarks about how there's a real push to just completely eliminate the tipped, because I think that's helpful for our advocacy on this issue. But as you can see, you know, if we do not get on this path. We are far below where our neighboring states are. And, we're seeing in terms of workers who are in the caregiving economy, especially, what a problem that is. We're having wait lists for both senior care and child care because there aren't enough workers who will do those jobs when they can go across the line to Connecticut or Massachusetts and be making the higher wage. So it really is a moment where we hope that we can get this across the finish line. And of course, getting to 15 by 2025 is way late. We should have been there right now. But at least it is a recognition that we will be moving towards that and not be stuck at the where we are right now. The next thing that you talked about was around increasing the taxes on those who are most able to pay. And I just wanted to highlight a piece that we recently put out from data from another of our national partners, the Institute for Taxation and Economic Policy. This is Rhode Island specific data that looks at the tax breakdown for Rhode Islanders based on ethnicity or race. And as you can see, in the lowest 20% of taxpayers, they are much more likely to be Black or Latinx, whereas when you get to the top 20% of taxpayers, they are more likely to be white. So what does that mean? Well, it means that if we're asking the folks in the top 1%, not even in the top 20, but the top 1%, they will largely be the white Rhode Islanders who have survived this pandemic and have not seen any impact to their income. And we think this is a moment where it is important to ask them to pay more so that not just next year, but in the out years, we're able to continue to provide the goods and services that we all need to support our state going forward. We know we'll get some federal support this year, but that will only last a year or so. And so we need to have the permanent tax change in order to support the state in an ongoing way. So that campaign is called revenueforrhodeisland.org, and you can go there to see both the pieces that I talked about, some other pieces on why this is good policy. One thing that has just recently come out that may not even be on the website yet is that this is a wildly popular proposal. Over 71% of Rhode Islanders in a recent poll that just came out supported the proposal across all lines of who they voted for, et cetera. So, this is a popular proposal, and we think that the time to do it is now. At the opposite end is our of the tax picture are those who are living in poverty. And one piece that we think is really important to continue to talk about is our families who are living on welfare, which is our Rhode Island Works program. Those families have not seen a benefit increase in over 30 years, which means that they are living over 50% below the federal poverty level. These are largely moms taking care of children. Sometimes it's grandparents taking care of children. But this is really unacceptable and is something that it is time for the state to focus on and be sure that we do something about. We're the only state in New England who hasn't increased our benefit amount, and we are not even trying to get them to the poverty level wages, just an increase, and we think there is the funding to do that this year. So that campaign is called the raisingri.org, and there's legislation that has had hearings in both the Senate and the House by Senator Murray and Representative Handy. So we encourage you to go to the website and get involved with this campaign. There'll be some more actions going on soon. And as you mentioned, if we've learned nothing in this pandemic, it's that caregiving is so important, and that families being able to balance their work and their family obligations is tantamount to us being able to function as a society and as an economy. As part of the Right from the Start Coalition, we are focusing on a number of pieces of legislation. I'm going to hit two this morning about child care policy. I think Representative Casimiro is on the call today, and she has been a real champion in recognizing that our child care workers who ensure that everyone can still go to work and can have a safe educational place for their children to go, can be paid an amount that allows them to be able to support their own families. Currently, that is not the case. The average child care worker in Rhode Island makes less than $12 an hour. And so Rep. Casimiro and Senator Cano have put in legislation that would require the state to come up with a path towards a better paying wage for those providers. We also are encouraging the legislature to pass the Child Care's Essential Act. And this bill is really looking at supporting both families and those child care providers. So increasing the reimbursement rates for the providers who provide the care, recognizing that infant care is the most expensive and that there should be a bonus for providing the care for infants. And then for the family side, recognizing that a lot of families, even if they're making over the current eligibility limit, simply cannot afford to pay for their children to be in safe quality care. So increasing that eligibility limit and then capping the copayment amounts. The state will be getting a lot of federal money coming in specifically to focus on childcare. And so we think this is a moment to be bold and really make some important systematic changes, both for families and for the system. Related to childcare is family leave. You know, we know that, and we've seen it certainly at my house, that there are moments, especially during this pandemic, where you need to take a significant amount of time to caregive for someone who is not well. Or to take care of a new child. So as Naomi mentioned, we are one of the leaders in the nation in having our own paid leave program and our own paid sick leave program. But what we have found is that lower wage workers are all too often paying into the system, but then not using the program because they are finding that they cannot survive on 60% of their wages, which is how much the current program provides. Senator Golden's bill would work to address this both in increasing the number of weeks. As Naomi mentioned, 4 is often not enough. So this would increase the number of weeks, increase the amount that individuals get while they're out on leave, and then work on thinking about how to ensure that those low wage workers who are paying into the system can get a credit if they're not ending up using it, because we know that every dollar is necessary for families near that minimum wage scale or level. So Senator Golden's bill is actually up for a hearing tomorrow afternoon in Senate Labor. We encourage you to weigh in, especially if you have a story about why you haven't been able to use paid leave. This bill would also expand it to gig workers and self-employed individuals, another area where we saw in this economy and we saw during COVID that those gig workers were able to get UI for the first time, and what a difference that made for so many people. The same is true for paid leave. Move. And then the equity for immigrants pieces, you know, as I mentioned, we don't currently, we haven't seen any proposals to provide direct benefits for immigrants who've been left out of all of the federal support, but there are 2 important pieces that are moving forward, we hope, this year. One is covering all kids, which would provide right care coverage for income eligible children without regard to immigration status. Rhode Island is really a leader in providing health insurance for all of its children, but this is a group that has been left out, and we think it's time to include those kids in our Right Care program. And then driver's license for all. You know, this is an issue that has been long fought by the undocumented community for years. You know, this is really a safety issue requiring or allowing folks who may not have a social security number but can establish their residency in Rhode Island to allow them to get a driver's license so that they can take care of their families and also be able to support, be able to have the safety requirements that we all have in order to drive a car. So the insurance, the driver's test, etc. So we think this is a really important proposal that we hope will move some this year. And then just briefly, I wanted to mention that we know that these are not specifically worker-focused issues, but thinking about the healthcare sector, talking about the care economy and how we need to support our seniors and those who are living with disabilities who may be in congregate care settings or hoping to be able to stay in their own homes. There are the workers who provide those supports to seniors and people with disabilities are all too often underpaid. And so there's a number of proposals around increasing the pay for those workers, and then ensuring that there's adequate staffing. The Raise the Bar campaign is certainly a very important one to make sure that the workers are not working too many hours and are able to be protected and take care of those. Certainly the nursing home area was the hardest hit by COVID and is one where we should really be supporting those essential workers in this moment. And affordable housing is another one. Without housing, workers don't have anywhere to live. Rhode Island has a huge affordable housing crisis. So there are proposals to expand the production of affordable housing. And the one piece of good news is the source of income bill, which has been long fought by a number of advocates, actually was just signed into law, which means that people cannot discriminate against you based on what your income is. So if you have a Section 8 voucher, it has been the case that people would say, no, I won't take you. And now that would be made illegal. The other thing I just wanted to mention really briefly is around the fair pay legislation that has been championed by Senator Golden and Representative Donovan. That would just ensure that workers are not discriminated against based on their gender or on their race or ethnicity. So of course, those are very important pieces of this puzzle as well as the wage theft laws, wage theft proposals. So we could go on and on all day, but we don't want to do that. So we encourage you to engage with any of our campaigns that we've talked about today. There are signups on our website that you can find out more information or find out when there are activities to engage with. And then here's just our contact information. Our e-news, we try to send out information about when things are coming up and share them on our social media as well. So that was a lot of talking on my part. So let's see if we have questions. So Juan, I think you're going to help us out with those. While he's getting us started, I did see earlier there was one question, Naomi, about the business community. And so thinking about, what is the business community's reaction either to fair pay increases, even the one fair wage campaigns. Can you talk a little bit about that?
Yeah, I'm happy to. And my colleague, David Cooper at EARN is really our expert on minimum wage stuff. So I'm also happy to connect folks with him afterwards, but just let me dig in for a second. So, during any minimum wage campaign, the business community is always going to say, if you raise the cost of labor, you're going to reduce the demand for it. In other words, that employers will cut jobs. And that, of course, makes policymakers nervous. Who wants to be responsible for losing their community a bunch of jobs? So, and this has been the dominant, this threat of job loss has been sort of the dominant thinking about higher minimum wages for a long time. But over the past 30 years, as more states have raised their minimums above the federal wage, it spurred a huge amount of research on this. And the research consistently finds that higher minimum wages have had little, if any, impact on jobs. And businesses adjust to higher minimum wages because they're able to take advantage of less turnover among staff and higher productivity. Some of them will decide to shift income out of their profits into wages. And so when you look at Walmart and Amazon, who raised their minimum wages to $15 an hour before there was an actually a law, they thought it was both sort of politically feasible and economically feasible for them to do that. And then more commonly, I would say there are small price increases. Employers use very small price increases to make up for the labor costs. And so research shows that for about every 10% increase in the minimum wage, prices go up by half a percentage point. And when you look at polling, like most folks are, and they're able to, distribute those price increases across a large share of the market. And when you look at polling, folks are willing to pay another 15 cents, 25 cents, whatever, for their Whopper or Big Mac in order to make wages more livable for other folks. On the tipped minimum wage side of the equation, well, and I should say, in addition to the how the businesses adjust, there are broader economic outcomes too with the minimum wage, because more money is going into lower wage workers' pockets and households. And when they have more, they can spend more. And so you see this uptick in consumer spending and a downturn in both inequality and reliance on public assistance. But I'm going to dig into the restaurant industry thing really quickly. The restaurant industry says that raising the tip minimum wage will completely destroy them, and it's just false. And over the past decade, in the one fair wage states, and again, that's the states where all workers make the same, whether or not they're tipped or not. The number of full service restaurants, the number of people employed at full service restaurants, and the tipped workers' take-home pay is substantially higher than it is in states that have a lower tipped minimum wage. So all the tales of death and destruction just don't really come to pass.
Great, thank you. And Mary Fox has asked, what are your thoughts on a tiered minimum wage for those under 18 or 21 versus mature worker?
Yeah, I would say we're not supportive of a tiered minimum wage. I think it gets very tricky when you start to do that. You never know what sort of life circumstance those workers are facing, and it's the vast majority of people who, maybe not the vast, the majority of people who are earning the minimum wage are workers over 20, I think, or so. And I can pull those stats for you, but we really think it's important to have a fair minimum wage that applies to everybody that is earning it.
Sorry, I lost my screen. Yeah, I mean, we find too, we have people who will testify about how they are teenagers, but they're helping support their families. And so
exactly.
It's a fallacy that you've got, that teenagers are just using it to buy electronics or whatever it is.
Exactly.
Senator Goldsman has asked that there's been a lot of press about some employers, especially restaurants, having a hard time recruiting people to return to work, with some employers pushing a narrative that people are choosing to stay home because UI pays more now. At the same time, we've seen an extraordinary loss of women in the workforce because of caregiving responsibilities. What's the response to those employers? And while some employers think the solution is cutting UI benefits, what would be a better solution?
Yeah, I think the problem isn't that UI benefits are too generous. These benefits are simply allowing people to meet their basic living expenses without having to accept jobs that put them in harm's way. And I think there's still a lot of folks that are legitimately worried about contracting the virus. I know Rhode Island's vaccination rates have been pretty strong, at least on par, or sometimes a little bit better than the rest of the country. But it still means like, fully 2/3 of folks in Rhode Island aren't vaccinated. And that's scary for low wage workers who have less bargaining power with the employer to demand safe workplaces. And so we're not out of the woods, and working people know that. On top of the fear of contracting the virus, or the care responsibilities that women in particular are still having to grapple with. That hasn't been resolved. And so there are these very real dynamics that are happening for workers. And I'll say, from the business perspective, even before the pandemic, employers were complaining about labor shortages and that they haven't been able to find enough workers who are willing to work. And I'm lucky to work with Heidi Shearholtz, who's the former Department of Labor chief economist, and she's the current head of our policy team. And she says, whenever you hear an employer say that they have a labor shortage, that they can't find workers who are willing to work, you have to add to that sentence that the wages employers are trying to get away with paying. There aren't enough workers who are willing to work, particularly when it involves taking on a significant health risk, at the wages employers are trying to get away with paying. And so in normal times, employers would imagine labor shortages should be paying more, but in a pandemic, workers need to be paid even more because of the public health risk, the caregiving responsibilities, all of the things that workers are facing. And so I think that those arguments just don't really hold water.
Great, and we're just at time, but Jim has asked if the U.S. Senate is hesitant to do a $15 minimum wage. What are the prospects of a compromise increase this year? What are the advocates saying about a compromise minimum wage? So maybe you can end us out with your crystal ball on that front.
I wish I had a crystal ball on this. I think folks are not super excited about a compromise. Unless the compromise is just to stretch the steps to get to minimum wage over another year or so. But, I think that advocates are holding pretty firm on this one. So, yeah. Sorry, I don't have a better answer, Jim.
But that's good news, I think, right?
Yeah.
Because as you said to us at the beginning, it's really important to be advocating for the policies you want, not trying to do the incremental pieces. So, well, thank you so much, Naomi. We really appreciate your remarks today. I know they've motivated and inspired me to keep fighting for the next couple months during this session and for the years ahead. And I know that so many folks on the call also feel the same way. So thanks for everybody who joined us today, and we will share the recording and the some of the data and resources that we provided so you can use it in all of your work. And we hope to see you advocating for positive policies going forward. So thanks so much, everybody.